So we've got Dr. Jason Reingold here, and he is a cardiologist. Dr. Jason, tell me a little bit about your background.
Started off my training here at Emory, which is great. It's a great cardiology powerhouse in the South. And then I was really fortunate enough to be able to travel and get training in Texas, California, and ending up with my cardiology training at Massachusetts General Hospital, which is one of the Harvard Medical School affiliates. It was a great place to get really interested in preventive cardiology and learn about some of the use of CAT scans and some of these new ways to detect heart disease.
Well, the testimonial that we just saw, the gentleman went to virtual imaging and had a massive heart blockage. Now, when you see somebody like that, is it better to see them before they have a heart attack, or is it more complicated once they've had a heart attack, assuming that they survive?
Yeah, so I think there's a couple of things that we need to talk about. So first of all, when people are talking about having a heart attack, what that means is there's at least evidence of some of the heart tissue being damaged and dying.
So I guess the take home, folks, is that go to virtual imaging, get a CT scan, find out if you've got your heart blocked prior to having a heart attack.
Yes, it's the same thing as cancer. It's much easier to deal with a breast mass or a colon mass that is in its earlier stages.
I'm just an average guy. I'm just like the viewer out there. I didn't think I had a problem. I'm 56 years old, and this is a chart that says that. Tell me what this means, doctor.
Well, let me just make the point that what this test does, and you're a great example, is that we have reclassified you. What that means is you are a 56-year-old, look at you, you look great. You don't look like you have some of the traditional risk factors. And again, if you were to go to your doctor, about 70% of people who have a heart attack were told, just like you, they were low risk.
And I'm in the 70 percentile.
You are in that group of people that, we would just look at and say you're low risk. But again, the truth tube actually says no, based on this plaque that we're seeing, your vessels, unfortunately, are not doing as well as we thought. And as a result, I'm going to reclassify you as someone who is low risk to now a more moderate to higher risk.
I guess what I'm asking, I can bring my score down from about 170.
So what I want to say is we can lower your heart attack risk, and we're going to lower your stroke risk.
Hallelujah.
And so we now know that there is something wrong in your blood vessels. We know that the blood vessels to the heart are not working as they should.
Yep.
And we are going to reverse that process. We're going to reverse this abnormal process.
Yeah.
By changing your lifestyle, by looking at supplements, by looking at medications, we can change the physiology that's going on here, and it can translate into reduced risk of heart attack and stroke.
Don't wait, pick up the phone, go online. Virtual imaging is offering a free heart scan.